Good morning, everyone. My name is Dora Smith, and I am a caseworker for the local independent living community here in Louisiana. Today, I will be advocating for my client, Miss Georgia, who has been a resident for the local independent living community for around 2 years now. According to her doctors, aside from taking medication for her blood pressure and arthritis, Miss Georgia is in good health. However, in recent weeks, her caregivers have begun to express some concerns about her recent behavior. We have recently noticed that Miss Georgia has started to skip meals and on one occasion has left her front door open, as well as calling her grandson by his father's name during their most recent visits. After a careful evaluation, it was clear that Miss Georgia was in the early stages of dementia or Alzheimer's, which is a condition that affects the cognitive functions of the brain and makes remembering to do everyday tasks such as eating and taking medications extremely difficult. Miss Georgia has begun to show the common symptoms of dementia, such as forgetting to eat, not closing her front door, and confusing her grandson with his father. However, because she is on medication for her blood pressure, I am concerned that she may have vascular dementia, which can be caused by elevated blood pressure. This form of dementia has the same symptoms as Alzheimer's. However, it can cause cognitive functions to decrease at a more rapid rate, making it more difficult to treat. I recommend running cognitive and neuropsychology tests to measure the memory and language abilities, as well as a PET scan and a psych evaluation, so that we can determine the severity of the disease and narrow down the treatment options. I also recommend doing cardiovascular tests to see if there is any changes in her blood pressure as well as her cardiovascular activity that we need to be aware of before we make any official diagnoses. For treatment, I would recommend that she sees a therapist that can work with her to enhance her memory as well as her cognitive skills. I also would recommend that someone come in daily to make sure that she eats, make sure she takes her medications, and will place reminders around the house for her in places that she will see them to remind her to do things like eat and take her medications and get in the shower and things like that. Another thing I would recommend is for her family to try and visit more regularly if they are able to do so. And when they do visit, I recommend that they cook her favorite meals or play music that she used to listen to when she was younger. Because things like that, like smells and sounds, can trigger memories and help her feel less confused and less worried in her environment. I also advise that the family remains patient with her and does not get upset when she does not remember things as quickly as they believe she should. And I look forward to continuing to work with Miss Georgia and her family in the future to help continue to improve her diagnosis. Thank you. Have a nice day.